Should postmenopausal women use the FRAX tool? Imagine a simple way to understand your risk of breaking a bone in the next 10 years. That's what the FRAX tool offers for postmenopausal women. It's a widely used and validated method to estimate fracture risk. Because women after menopause are more likely to develop osteoporosis, assessing their fracture risk helps decide if treatment is needed. The FRAX tool combines several factors like age, weight, height, smoking, alcohol use, previous fractures, and family history. It can also include bone mineral density measurements if available. This helps create a personalized risk profile, which is more accurate than just looking at bone density alone. Research shows that the FRAX tool predicts hip fractures quite well in postmenopausal women. It has been tested across many countries and populations, confirming its reliability. Many clinical guidelines recommend using FRAX to identify women at high risk of fractures. If a woman's risk score is high, her healthcare provider might suggest starting medications to strengthen bones and prevent fractures. For women with intermediate risk, additional testing like a bone density scan can help clarify their situation. Sometimes, women with previous fragility fractures may be considered for treatment even without a FRAX score. Using FRAX is also helpful from a healthcare cost perspective. It helps target treatment to those who need it most, avoiding unnecessary medication for low-risk women. However, it's important to remember that FRAX doesn't include every possible risk factor. For example, falls history or the dose and duration of certain medications are not part of the calculation. So, clinical judgment remains essential. In summary, postmenopausal women should consider using the FRAX tool as part of their osteoporosis management. It provides a scientifically validated way to estimate fracture risk and guide treatment decisions. But always discuss your individual risk factors and concerns with your healthcare provider. They can interpret your FRAX score in the context of your overall health and help you make the best choices for your bone health. Remember, personalized care is key to preventing fractures and maintaining quality of life.